Hi, my name is Catharine Crawford. I'm a registered psychotherapist and I am on the team at Maple Shores Health Center in Port Elgin. Our office is currently closed due to the pandemic, and many of us are going to be posting some videos and have already posted some interesting articles for you, informational at this difficult time. And there are some practitioners here at Maple Shores offering telephone or video conferencing sessions to help you with a concern you might have. As a psychotherapist, I am offering currently telephone and video counseling, kept very secure and confidential with a secure video platform or by telephone. So if you're interested in that, I can provide my number at the end of this video in case you would like to book a session. So I wanted to tell you a little bit about how psychotherapy and counseling are slightly different. So you might be interested to know that counseling is a little bit more solution-focused, problem-based, a specific scenario that you would like guidance for, or a situation with a relationship coming up currently for you, or perhaps parenting guidance, thinking about a job or what to do with your time right now, or perhaps another vocational or relationship issue that you're noticing is something you'd like advice about. Psychotherapy is generally for more deeper trends in your life that are more long-term and might be related to like a diagnosis of anxiety, depression, post-traumatic stress, another kind of mood disorder, or perhaps obsessive compulsive disorder, eating disorders, or just like a more serious problem that doesn't have a diagnosis that you feel is really pervasive in your life and can be related to patterns that have developed in your life that might take a little bit longer to unwind and solve through psychotherapy. And there's many methods used in psychotherapy: mindfulness-based self-compassion, eye movement desensitization and reprocessing for trauma, dialectical behavior therapy skills, cognitive behavior therapy skills, and guided imagery for stress reduction. So there's lots of therapies available to help in psychotherapy and counseling, and sometimes they happen within a course of therapy. Several modalities might be chosen to help you. And also at this difficult time, I wanted to mention a couple of websites for your interest. First, highlighting self-compassion. So self-compassion is coming out of compassion-based therapy that says it's good to have compassion for others in suffering, but we can't forget ourselves. When times are hard or we're going through something difficult, it's better not to attack ourselves or judge ourselves. If we've truly done something problematic or wrong, then we can make amends and repair that. But if we're just attacking ourselves due to stress or perfection or just a habit of criticism, then it's a good time for self-compassion. Self-compassion is also good when we feel like there's things that we can't change, or we're stuck with pain or a difficult situation that is happening right now. And self-compassion was developed by Kristin Neff, and you may have heard of her book, Self-Compassion, and her website is selfcompassion.org. Her colleague, Christopher Germer, has a website at christophergermer.com, and they partnered together to develop a program called the Mindful Self-Compassion Program. And they both have websites with meditations on them. So christophergermer.com and selfcompassion.org. And both Chris and Christopher have exercises and meditation and information that might be interesting for you to look at right now. There's also a really good app for anxiety called Mind Shift, and it's cognitive behavior therapy tips and tracking for anxiety. I think that could be really helpful for some of you. As well, a quick tip from me: if you're feeling stuck in something and you're ruminating, or you feel overwhelmed with an emotion, anger, sadness, anxiety, just stop what you're doing and saying, I'm really stuck in gear and I'm just going to do something different. I'm going to clean out a drawer, or organize some shelves, go for a walk outside with good social distancing, do some quick exercise, take a bath, make yourself a hot or cold drink, something to focus on that's different than the thoughts that you feel overwhelmed by. Sometimes it's not what we think, it's what we do. And that's a good behavior therapy, like quick tip for you. So, if you'd like to make a session during the pandemic, I just wanted to offer my telephone number, 519-386-2310, or you can go to mapleshores.ca and look under our teams and seek practitioner names. And my name is Catharine Crawford. So I'm wishing you safety and well-being at this time and look forward to potentially hearing from you in the future. All the best.